Hello everybody and welcome back to my YouTube channel. And in today's video, we are going to discuss in a very comprehensive way certain examinations that you need to qualify or you need to pass in order to practice pharmacy as a pharmacist or as a clinical pharmacist or as a pharmacy technical assistant. So these are the different examinations that are available: PSI, and then you have NHRA, National Health Regulatory Authority for Bahrain. Then you have DOH, DHA, Haad, MOH, Ministry of Health, and Australian Pharmacy Council ki APC ki you have Kaps, and it's going to be now getting converted into Opra overseas examinations. So these are the different examinations for different countries, like for Gulf countries, Dubai, Saudi Arabia, UAE, and all. There are different examinations like DOH, DHA, MOH, HAD. For practicing in Ireland, Dublin, you have PSI and all. For Bahrain, there's NHRA. So these all examinations are available because why do people migrate from India? One of the major reason is recognition is not that good enough for pharmacists especially and pharmacy technicians and even paramedical staff in that case. And the other very important thing that is there is the cost. There's very less salary that's available. So we are going to discuss in detail about the examinations, like their patterns, the syllabus, and what all things are to be included. Speaking about the advantages, firstly, global mobility. You get a lot of exposure to what are medications, right, from generics, complex generics, branded generics, to the the brand medications, proprietary medications, right, from your sound-alike drugs to your high-risk medications. You get an access to prescribing, dispensing the prescriptions. So that is a very good. Then you have high earning opportunities because in Middle East countries and European countries, there's very good pay. There is leaves, bonuses, housing allowances, and so many different things that are additional perks or benefits. Then there is sustainability and growth because somebody's planning to settle out there, so you can get into different kinds of posts ahead, like healthcare managers, regulatory bodies as well, if you have a good experience as a pharmacist practitioner or a pharmacist technical assistant or anything. Global credibility, like once amongst your peers you can get an idea, like even if you want to return back to your hometown or in country like India, you can tell that I have an experience of working in Dubai, in working in Bahrain, and working in Australia, or whichever country. Like, then of course there's a good work-life balance. I must tell that there's no workload extra. There's proper structuring work hours. They abide by the rules and they are very disciplined with respect to the working hours. And this is a really cool opportunity. Like if you want to go ahead, and then we'll also discuss about the different institutions that provide mentorship and the institution that provide tutorials for the same. Like you have academically global. They provide lot, like from optometry to dentists to medical practitioners to pharmacists to nurses. There are a lot of different courses available for these countries, for getting into these countries, and the faculties are also very trained. There is a proper training program that is carried out, so that's really good institution from which you can take some mentorship or guidance. First exam is Kaps, is for Australia. It is having two parts, part one and part two. Part two is clinical science, where all the application based questions or case study based questions appear. Like Miss Monica is 60 years old. She has been suffering from UTI. She's been prescribed gatifloxacin, and then she's also having arrhythmia. So amiodarone, what are the chances of QT prolonged? Something like that. Case study based questions. So in this you have pharmaceutics, where suspension, emulsion, or your calculation based questions, suppositories, dosage form. Therapeutics, pharmacotherapeutics, dosage regime sometimes are being asked, like for DOTS therapy, for heart, for AIDS, a highly active antiretroviral therapy, for triple therapy, quadruple therapy, for ulcers. So these kind of questions could be popped in. Clinical pharmacy and pharmacy practice in hospital pharmacies, again you have a lot of methods, like the drug dispensing systems. Big their questions are the drug interactions or clinical manifestations. In the basic sciences, we classify anatomy and pathophysiology. So you have some parts of HAP basics. You fundamentals must be clear. Pharmacology, absolutely. But pharmacokinetic, pharmacodynamics, drugs and antidotes, drugs and active metabolites, mechanism of those drugs. That's very important, right from antimicrobials to antifungal, viral, protozoal, malarial, cardiovascular drugs, arrhythmia, angina, lipidemia, coagulants, fibrinolytic agents, hypertension, to your CNS drugs, right, from your Alzheimer, Parkinson, Huntington, multiple sclerosis, epilepsy, depression, to your endocrine diabetes, anesthetic, local and general anesthetics, to your respiratory asthma, ulcers and tussives, All those classifications you must be aware, it should be at the tip of your tongue. Next, you have MOH, Ministry of Health, that is for UAE, United Arab Emirates. That is also a computer-based MCQ test where you have pharmacology, therapeutics, practical based. And most of these examinations, they are very application based and practical based. They ask you questions that involve into critical thinking and decision making. That which is a first line agent, which if this drug is having interaction with this particular, like digoxin is having interaction with thiazide diuretics, so will you give it spironolactone? Such kind of application based questions are being more often said to be asked. Then you have DHA, Dubai Health Authority, again for Dubai, where you have again the same laws and ethics. This is a new thing, and the new syllabus part that is there. So you must know about the laws, ethics, and all jurisprudence part basically. Patient counseling, like if there's suppose if there's any drug that is not to be taken with milk, like you have tetracyclines, or if there's any drug or anything that is not to be taken with food or is to be taken with food, like proton pump inhibitors are to be taken 1 hour of an hour prior, like griseofulvine is to be taken with food, indinavir is to be taken with fatty meals, so those kind of things. Then you have PSI for Ireland, Pharmaceutical Society of Ireland, and this you have drug dispensing, clinical pharmacy, pharmaceutical chemistry, you have chemistry also here. So be very careful because there are structural based questions that are asked, SAR based, like thiazole ring, morpholin ring, and all those things. So you can just have a look at it. Then you have Opra, Oman Pharmacy Regulatory Authority, and you also have overseas pharmaceutical. So there are a lot of questions based on calculations, pharmacology, and all. And then you have NHRA, National Health Regulatory Authorities from Perin. It covers the similar, most of them, if you see the syllabus is quite repetitive. So even if you're preparing for multiple examinations, though the fees is too high, but you cover almost every exam. Like in some there is chemistry extra, in some there is laws and ethics extra, some there is more focus on pharmacy practice, patient counseling, hospital pharmacy. So and some there is more focus on pharmacology, therapeutics, sudics. So it all depends upon the type of examination that you're doing. And this is the academically that I was talking about. It has really good recalls question because it has a lot of students who have passed, and there are questions, memory based questions, MBQs are there. Then they even design mock test, alter the mock test for FAQs, frequently asked questions. There are some previous year questions based on the memory based, and there are really good results. So you can just check out the same. And yeah, you can have this academically. You can just type academically global, and the YouTube channel Dr. Akram Ahmed. You can just have it for mentorship. You can follow, subscribe the channel as well. So this was it about the different examinations, right, from Kaps to Haad to DOH to DHA to MOH to Opera. And for more details, you can log into their sites and just have a look at there's different numbers that are available, so you can have a contact with them also. And yeah, have a good day, all of you. All the best, and keep shining and keep doing well.